I will be reviewing a few things related to your joints as well as your upcoming surgery. This presentation will focus on three major topics. First, I'll discuss the nature of arthritis and the benefits of joint replacement surgery. Second, provide an overview of expectations in the hospital surrounding both hip and knee replacements. And lastly, I'll discuss postoperative planning and what to expect when you are discharged. Arthritis is a general term for joint inflammation and, in short, a wearing out of the joint surface over time. This process can be accelerated by such factors as disease, obesity, injury, or abuse, amongst other things. Fortunately, in today's world, we can improve this condition with joint replacement procedures. The major benefit of joint replacement surgery is to substantially reduce joint pain, increase mobility, which can improve your quality of life. Furthermore, joint replacements have been proven to be extremely durable. Both hip and knee replacements can last longer than 15 years, and statistically there's less than a 1% failure rate per year. Throughout your surgery and recovery, we use a variety of different medications to control your pain. You will be up and out of bed with our physical and occupational therapy teams the day of surgery and be able to put full weight on your new joint without doing damage to it. Early motion and mobility are encouraged after surgery. You will be initially instructed on how to walk safely with an assisted device. Lastly, there are some discharge planning issues to consider. If you progress well and meet certain milestones that allow for independent function, you will be able to go home the same day of surgery. Otherwise, you'll stay overnight, repeat therapy sessions that morning, and be able to be discharged that day. Once discharged, you can follow the Force Therapeutics online platform, which can assist you in your recovery. In addition to self-performed exercises, depending on preference, a home physical therapy or outpatient therapy program can be arranged for you as well. As you progress after joint replacement surgery, you will be able to do activities routinely such as shopping, walking, biking, swimming, golfing, and even dancing. Restricted activities are few, but include impact activities such as running and jumping, which can prematurely damage or loosen the metal and plastic components of your new joint. You can discuss any specifics with your surgeon. With Geisinger, you'll have a renowned operative team, state-of-the-art facility, and we hope an overall excellent experience. Our system performs more than 2,000 joint replacements per year. We have the experience, knowledge, and expertise to guide you through.